Hi everyone, my name is Danielle DeWash. I'm a family nurse practitioner and also the owner of DeWash Medical Clinic. All the information I'm going to release to you can be found at dmchealth.care, and you can get all of these notes. Today's video is going to be about syphilis. In 2018, the Center for Disease Control and Infection, better known as the CDC has reported 150 cases of sexually transmitted diseases or sexually transmitted infections that are included chlamydia, gonorrhea, and syphilis. Well, in the past 5 years, syphilis cases have increased by 91%. I'm wondering why. But remember, syphilis doesn't hurt. Herpes hurts, but syphilis doesn't hurt. And then also the clinical presentation for syphilis, it will affect your genital areas, and then also it will affect your mouth. People sometimes they feel, well, I don't want to go to the doctor because it's embarrassing. What causing syphilis? Well, syphilis is caused by a spirochete bacterium that can cause several damages to your organs and to your skin. Syphilis has divided by 4 stages. You have primary, secondary, and you have the latent stage, and then you have the tertiary stage, which is the late stage. On the primary stage of syphilis, people can exhibit some kind of symptoms of cutaneous gummas. Their skin, they have some kind of deep, well, they're not so deep, they have some skin issues, but they do not itch, especially on their private area or genital areas. That's where they have these sores. The sores, they are painless and they do not itch. That's the problem. It can also present on their tongue, on their gums, and their cheeks inside, on their lips. And then if you kiss somebody and you have syphilis, and then you have these sores in your mouth, and you can transmit it like that as well. So people, when you have sores in your mouth, or you have it in your genital areas, you need to seek medical attention so you can have some tests done. There's a test called non-treponemal syphilis test. It's a serology test we can do. And then if it is reactive, then we're going to move to the treponemal test. So what can we do to stop syphilis from arising? We need to be part of the problem, of the solution, not part of the problem. Too many people have died from syphilis or carry syphilis and then causing a lot of damages to their internal organs. When syphilis moves to the second stage, people can have some sores on their hands, the palm of their hands. Also, they can have it on the bottom of their feet, the sole of their feet. Usually it's 4 to 10 weeks after the initial infection. The primary infection, 3 to 90 days after you've been exposed to the syphilis. So that's when you have the flu-like symptoms, and then the sores in your private areas, and in your mouth and your gums. So let's move to the tertiary, not tertiary, to the latent stage of syphilis. This one is hidden. You don't have any sign and symptoms. You might think that, well, I am out of the woods. No, you're not. It's hidden. You don't have sign and symptoms. 3 to 15 years later, according to research studies, 15 to 30% of people, they're starting having sign of symptoms, abdominal pain, because it affects their liver. It's called gummas, syphilis. That's when you have the deep tissues in your liver that's starting to become ulcers, and they become necrotics. So it can affect also your central nervous system. They call it tabes dorsalis. The tabe dorsalis, what happens is it affects your central nervous system. You start becoming deaf. You're losing your hearing, and then you cannot see. So your doctor can prescribe for you to have cerebrospinal fluid to see if you have the infection, and then they can confirm it with dark field. We need to prevent that from happening. How can we do that? Well, you need to have one sexual partner. Do not get involved in multiple sexual partners. You use condoms, or you can use abstinence and get tested. If you have somebody, for example, you know that they've been around with other people, you need to get them tested so that you both can be safe. They might say that they don't have any problem, and then they do have problems. They might say that they don't. Don't listen to them. What you need to do, you need to say, hey, if you love me enough, we both can get tested for that infection. How do we treat syphilis? Penicillin benzathine G, that's the one that we use, and we prescribe for people to get it intramuscularly, deep. So it can be a single dose if you have early syphilis or secondary syphilis or latent. But if you have latent syphilis, you have late stage syphilis, so we're going to have every week one shot of penicillin G benzathine for 3 weeks. If you cannot take penicillin because you're allergic to penicillin, we can put you on doxycycline or tetracyclines by mouth for 10 to 14 days if you are on the early or secondary. But if you are on the late stage of syphilis, you're going to have the doxycycline, tetracyclines for 30 days. So that's how we treat, and then we order the test to see where you are. But if you are pregnant, you cannot have doxycycline or tetracyclines. We can put you on antibiotic called macrolides, which is erythromycin or azithromycin. But remember, these antibiotics, they do not cross the placenta well. So your unborn child, fetus, cannot be protected well the way that we want that child, that unborn child, to be protected. So abstinence is the key. Get tested early, and then you can prevent syphilis from spreading. Let's be part of the solution, not part of the problem. Let's do it together. Don't forget to visit my website, dmchealth.care, for the notes or book your appointment. Remember to follow me on social media. Most importantly, follow Jesus. Your body is the temple of Christ. You need to take good care of it. Have a wonderful day. See you next time.